Innovation at Sutter is leading the transformation of care, primarily through empathizing with patients and their families, and ultimately reducing friction and meeting their needs, both latent and explicit. So Silicon Valley is known to be fast. It's known to be explosive in its thinking, and so we've embraced the big, bold questions that we should be thinking about in healthcare, and then embrace the speed. So operating on a 90-day cycle, going really fast and sprinting, figuring it out, moving on to the next thing. So big questions, but fast answers. We see outsiders in healthcare bringing the fuel source. So in perhaps environments that are less regulated or less constrained, that are thinking big and bold about different industries or different ways that people will use things, et cetera. So we look at outsiders as a great fuel source for what might be incorporated in healthcare at some time, but looking there for inspiration. And also look to them for provocative startup companies, just provocative thought. So looking at some other systems, and to be fair, I haven't spent a lot of time in other systems, but I think the observation would be that it's got to come from the top, like innovation as a mandate, innovation as a part of the strategic agenda, as the companies are. Otherwise, you hear about pilot fatigue and whatnot. Is a lot of that has to do with not being able to carry the innovation agenda from the core of the system and the top of the system. So I think the other thing I see is just slow decision making. So slow decision making will suffocate any great pioneering idea or startup. So it's not about being, it's not even about changing risk tolerance. I think risk tolerance is perfectly fine, but making those decisions fast so that there's an understanding with an outside organization or ourselves why or why not we can or can't do something. For other hospital leaders, it's unpack what's your unique reason for being in your environment. So it might be, if you're a small one hospital system, you're fast. You know, you can move quickly and try things out. And advice for other healthcare leaders just generally is thinking about, diversity of thought, not just diversity of population, but what are the different mindsets that we're bringing to any particular challenge. So not only a clinical mindset, but a operator's mindset, a data mindset, a user's mindset, all applied in a diverse pool of thought to get something done. So just allowing that to come into the system.